This video contains questions and answers formulated to easily understand about peptic ulcer. Information is taken from page 1116 of Bailey and Love's Short Practice of Surgery, 27th edition. Peptic ulcer. What is essential for the formation of peptic ulcers? Peptic ulcers require the presence of acid. Pepsin is not essentially important in peptic ulcer formation. In the absence of acid, peptic ulcers do not occur. What is the effect of proton pump inhibitors on peptic ulcers? Proton pump inhibitors can heal nearly all peptic ulcers. They can make a patient virtually achlorhydric, which means the absence of hydrochloric acid. What are the common sites for peptic ulcers? The first part of the duodenum, the lesser curvature of the stomach, the stoma following gastric surgery, the oesophagus, and Meckel's diverticulum, which contains ectopic gastric epithelium. What is the general location of peptic ulcers in relation to epithelia? Peptic ulcers occur at the junction between different types of epithelia, and they form in the epithelium least resistant to acid damage. How are acute and chronic peptic ulcers viewed clinically? The difference between acute and chronic peptic ulcers can be difficult to determine clinically. It is better to view them as a spectrum of disease, from superficial ulceration to deep chronic penetrating ulcers. What is the significance of acute stress ulceration? Acute stress ulceration can lead to perforation and bleeding. What is the relationship between gastric acid levels and peptic ulcers? Patients with duodenal and prepyloric ulcers have higher gastric acid levels compared to normal subjects. Patients with gastric ulcers often have normal gastric acid levels. High acid levels, such as those found in Zollinger-Ellison syndrome, can cause peptic ulceration. What are the genetic and social factors involved in peptic ulcers? Genetic factors may play a limited role. Social stress has been falsely implicated as a cause. What are the two most important factors in the development of peptic ulcers? Helicobacter pylori infection and the use of nonsteroidal anti-inflammatory drugs, also known as NSAIDs. How do Helicobacter pylori and NSAIDs contribute to peptic ulceration? They act synergistically to promote ulcer development and bleeding. What are the effects of cigarette smoking on peptic ulceration? Smoking predisposes to peptic ulceration and increases the relapse rate after treatment. Summary of peptic ulceration. What are the most common causes of peptic ulcers? Helicobacter pylori and NSAIDs. Which type of ulcer is more common, duodenal or gastric? Duodenal ulcers are more common than gastric ulcers. Are the symptoms of duodenal and gastric ulcers distinguishable? No, the symptoms are indistinguishable. What is the potential risk associated with gastric ulcers? Gastric ulcers may become malignant. An ulcerated gastric cancer may mimic a benign ulcer. What are the main treatments for peptic ulcers? Gastric antisecretory agents and Helicobacter pylori eradication therapy. How common is elective surgery for peptic ulcers today? Elective surgery is rarely performed, because long-term complications of surgery can be difficult to treat. What are the common complications of peptic ulcers? The common complications are perforation, bleeding, and stenosis. How is a perforated peptic ulcer typically treated? The treatment is primarily surgical, although some patients may be managed conservatively.